I'm Dr. Troy Spurrill, and our podcast is Synapse Snips. Our podcast teaches people about how the body is supposed to work, basically how we were innately made. Have you ever wondered why you get headaches? Ever wondered why you wake up and your feet don't work in the morning and they're achy, and then as you get walking, it gets better? Have you ever wondered why you don't remember your dreams? Have you ever wondered why you're gaining weight even though you're eating right, you're exercising, and the weight keeps coming on? Have you ever wondered why you're just feeling depressed? It's hard to get up off the couch. If you ever wondered about why you feel these things and why you're not just feeling right, listen to our podcast to get the answers. We get to the root cause and we tell you why. Make sure you're listening to Synapse Snips each and every week where we answer the questions that you guys have. Also, you can find us at officialsynapse.com. That's officialsynapse, synapse.com. Hi there, Dr. Troy here. I am here today to answer a very important question in regards to chronic fatigue versus burnout. So, on occasion, we get a question given to us by one of our patients, and we try and answer the questions that come in. If they're quick, simple questions, we will answer them because we get 100 messages a day. And so with an already booked schedule, we only have about 10 minutes in the entire day to answer questions because generally speaking, we're busy from 8 a.m. to 6 p.m. With no breaks. So it's one of those things where when we get a question that's a really good question and requires a lot of attention, a lot of times we'll say set up an appointment to talk about it. But this particular question, even in an appointment time, wouldn't quite do it justice. So I decided to do a podcast. In regards to answering the question of how do you measure and discern between chronic fatigue syndrome and burnout. So this gentleman who answered the question, I'm going to actually read it. It's a very detail-oriented thought process as far as the question. So I'm just going to read it, and then I'm going to show you a little bit behind the scenes of how I and we tend to operate, not only to answer questions like this, but just in general. So this is the question. Thanks very much for following up with these questions. In short, as you know, there are significant inherent and noteworthy differences between chronic stress-driven burnout and SEID. So SEID basically is systemic exertion intolerance disease. That's the new name for chronic fatigue syndrome. Inherent and noteworthy differences between chronic stress-driven burnout and SEID and other completely related causal factors that could contribute to low energy levels, each of which would need to be distinctly distinguished from each other to specifically identify what should be treated, or more importantly, to know the inherent nature of what's being treated, which is also a needed input to be able to clearly define what treatment success is. That said, and given I don't know what's behind the lower energy levels could be lingering burnout, I am wondering if there's established, clear, definitive, clinically significant causal studies that have identified and quantified specific biological values that the blood test results will be gathering can be compared against, and that will be definitively distinguished against burnout versus SEID or something different, entirely different, presuming there's any significant findings. What he's really asking for is how can you tell the difference between the two? Number one, and what tests do you use when it comes to trying to discern through that information? So there's a couple thought processes here because I want to go through this. I want to be a little bit not delicate, but the first part of my answer may seem a little harsh, but the answer is it doesn't matter. And what I mean by that is it doesn't matter which one you have when you look at it through a functional medicine lens, because we're going to look at all of it. So it does matter as far as getting the information he's asking for, because that's how we discern through what the body needs. My answer is it doesn't matter which one it is, because we don't necessarily use established medical protocols for that. We will look at the protocols, and I'm going to show you a little bit behind the scenes what that actually looks like. But really, we go by what the body is telling us. So we look at functional scenarios, functional disorders, and breakdown in communication, and then that'll tell us everything. So having said that, I'm going to go through my thought process and the data that we have that can help distinguish it. So first of all, I've been keeping all the information for research driven, what we've been doing for the last 30 years. It's all in one database. So when I go to our database, you'll see at the top here, open Google Docs. We have everything in our Google Docs section here. And this is one of my favorite pieces. This is from Dr. Lamb, medical doctor. And he does an in-depth look at the 4 stages of adrenal fatigue. So if you can see, he does a deep dive into just the adrenal fatigue part of it. I'm going to go through this in a little bit. But that's a 53 page. If you look at the bottom there, it says 53 pages. So it's not just a simple text that we can shoot back to answer the question. So I'm going to go through a few of these things. In the beginning here, he talks about the adrenal gland. It's the main stress control system of the body. Adrenal fatigue is a decrease in the adrenal gland's ability to carry out this normal function. It's commonly caused by chronic stress from any source, including emotional, physical, mental, or even environmental, that exceeds the body's capacity to adjust appropriately to the demands placed on it by the stress. Stresses that can lead to adrenal fatigue include anger, chronic illness, depression, surgery, high sugar intake, overexercise, sleep deprivation. That's number 1. He's got that highlighted, and that's one of the ones we focus on. Chronic or acute infections, including Giardia, H. pylori, and we're going to talk about some other ones. Root canal repair, just to mention a few, and there's many, many more. When you go through the 4 stages, there's the first one stage, alarm reaction, fight or flight response, and so we're going to go through a little bit of that. I'll skip down here to the next stage. Adrenal exhaustion refers to stage 3 of adrenal fatigue. The adrenals are no longer able to keep up. And there's some key words here. Cortisol output starts to decline. So in the beginning, adrenaline increases, and then eventually adrenaline gets replaced by cortisol, and cortisol becomes the long-term stress. So like if a tiger's chasing you, your body's going to release adrenaline, heart will race, and then you'll take off and run away. Long-term stress, like let's say starvation, after a while, cortisol will take over for adrenaline, and cortisol will start to actually store fat around your organs. So we can see things like non-alcoholic fatty liver start to develop, and we see this on lab work. So to answer your question, one of the things that we can do in our standard panels, blood panels, is just look at your triglycerides, look at your liver enzymes. If they're just barely elevated, or you fall into the category of non-alcoholic fatty liver disease, if you're not consuming alcohol, then that's the stress-driven reaction. So that's one test, one lab test. So we really look at the cortisol component. We're going to do a little bit deeper dive here on that in a little bit. And so adrenal failure is when you actually start to lose the ability to make the cortisol. And so you still have the metabolic reactions. For example, cortisol has an inhibitory impact on insulin and your thyroid. So we start to see your metabolism start to shut down, and that's getting close to adrenal failure, when you are unable to make the cortisol. And so we'll see things like joint achiness and other physical problems start to increase in the body as well, because cortisol does get converted to cortisone. And just like in athletes who have inflammation in their joints, they'll get a cortisone shot. Same thing here with your body. So we'll start to see achiness. So we will be able to tell, based on your physical presentation and how you're relaying to us, what stage you're in that adrenal fatigue failure scenario. And we don't even call it adrenal fatigue anymore. It's an HPA, hypothalamic pituitary adrenal axis dysfunction, and the systemic exertion intolerance disease, that's more of the chronic fatigue. So we're going to break that down a little bit more. So declining adrenal function, the next 50 pages are just talking a little bit about that. So this is one of my favorite documents, but here is just a single chart here. Phase A, chronic single system dysfunction. Phase B, multiple endocrine axis dysfunction. So because of the area of the brain, we're going to go through this a little bit later, other hormones will start to be affected. So we're going to look at your blood sugar and how you're using and managing your blood sugar, your thyroid, and we look for small patterns of dysfunction in there. We will also be able to assess how you're managing stress, and we do that in different ways as well. So with that, I like to go through, like from one of our documents here. This is an example. We have a lot of our files in there. So this is an example of one of our behind the scenes documents. So this is a protocol we established. I'm not even sure when this one was made, but it was a while ago. The updated adrenal 4 stages of adrenal fatigue PDF is in there. And that is what we were just looking at. And this is kind of how we will assess adrenal fatigue overview. This is a summary of the 4 different stages. And so here in stage 1, caffeine intake is common to mask mild fatigue. So we see people and we ask them questions like, do you drink coffee? Oh yeah, I need my coffee. Otherwise, I don't have the energy during the day. Well, that's a sign that you're at least going through the phase 1. The resistance, stage 2, we'll see things like the thyroid glands can be affected at this stage. Lab work is often normal. In the traditional world, in functional medicine, we can see patterns. For example, in the lab work, your TSH and thyroid numbers may be normal, but we can see that you might not be converting the actual T4 to T3, the inactive thyroid to the active thyroid, or reverse T3 will start to go up. Reverse T3 goes up during trauma, stress, and infections, things like that. So if it's blocking your thyroid, we can see that already way before there's ever actual hypothyroid symptoms that come on. In stage 3, one of the things I can want to point out here, adrenals no longer work. The patient can no longer function smoothly throughout the day. Body's primary goal is conservation of energy. So here's where we start to see your body is feeling like things are too stressed out inside, so we're going to conserve energy. It starts to shut your metabolism down to protect it. Reverse T3 goes up, which blocks active thyroid. It's basically a thyroid that kind of caps it so that the hormone can't actually work at the cell surface anymore. And then we start to see it downregulate insulin. Well, that starts to lead to insulin resistance in most people, which means you can't get sugar into the cell to actually start the mechanism of energy properly. And chronic fibromyalgia is common because as you start to see this, you start to see the achiness increase just in general because you don't have the conversion to cortisone as efficiently. You actually have a major anti-inflammatory in your body start to decrease. So the body becomes very sensitive within the muscles too. Depression may be severe. There's 4 phases of stage 3. The fatigue is chronic, multiple organ systems affected, body enters a state of disequilibrium, adrenaline rushes can happen. So you can see changes, high or low with blood pressure, hypoglycemic episodes, and anxiety or panic attacks even. So I want to just point something out there because that is a basically chronic stress-induced burnout, but they still use the term chronic fatigue. So there's a scenario here where chronic burnout will eventually induce a chronic fatigue state or a systemic exertion intolerance state because of the hormones and the breakdown in communication there. So I want you to kind of hear that. End stage, they're very similar, but they're different mechanisms that I'm going to go through as far as just in the beginning. So once you've got to phase D of the stage 3, I know it's very, very complicated, near adrenal failure, the body goes into a shutdown mode. This is where you start to see where like you just can't get out of bed. So it's more than just a, I just don't have my normal get up and go. Stage 4 adrenal failure. A lot of people will think they're in stage 4 adrenal failure, and when we tell them you're actually in stage 2, that becomes very, very challenging. Sorry, excuse me. I should have grabbed some water. All right, so with this being said, stage 4, we have a breakdown of the phases in stage 3, and we'll go through that. But the near failure stage is when there's constant crashes. It just doesn't take much physical exertion, even just mental exertion before the body starts to crash. It's rare to get to this stage and be functional. So most people are not functional. So let's just walk you through a few things. I'm just going to bring up some definitions here. SEID stands for Systemic Exertion Intolerance Disease and is the name for the disease previously known as chronic fatigue syndrome. And although they've reworked the name and everything like that, they're trying to get into the details of breaking this down a little bit. There is always a little crossover, which that's how the body works. In functional medicine, you're always going to have crossovers, and it's not going to be a perfect, broken out, black and white system. The medical community likes to try and think we're robots, but we're not. It's not just a linear thing. There's always going to be a crossover, and it's more like instead of just every instrument in an orchestra playing, it's the orchestra itself. So you have to look at the big picture of everything. All right, so then let's go into the HPA axis dysfunction. I'm going to move my face here just a little bit so that you can see over in this section here, the HPA axis is really the adrenal part of this, and that's the chronic stress. So it can happen, it can be an acute stressor as well, but it can happen slowly over time where we have this fight or flight response, low grade stress over long periods of time, or an acute stress. And people know that if you've had like an acute stress, we will see things like an ulcer develop. Well, why does the ulcer develop? Well, because you're stuck in fight or flight, you're not in rest and digest. So the HPA axis is referring to the hypothalamic, pituitary, adrenal axis. So the hypothalamus regulates the fight or fight versus rest and digest. If you're in fight or flight, you can't be in rest and digest. So this is important because your vagus nerve, which is the main rest and digest parasympathetic nerve, stops supporting your digestive system, and so you don't get the nerve going to the stomach and the digestive system, and ulcers can actually occur from that because it's not being regulated. You actually get an increase in acid released, and you get decreased blood flow from the outside of the stomach, supporting the nutrients of the stomach, which is really just a muscle. So you can start to see problems. Now this HPA axis diagram that we've got right here is actually showing how the hypothalamus will fire to the anterior pituitary, which fires and releases ACTH, adrenal corticotropin stimulating hormone, and so that stimulates the adrenal cortex to release cortisol, and it feeds back to the brain. And that's the stress loop that we see there. Now, a lot of different things can happen because if a stress response occurs, blood pressure can go up. We can start to see changes in your cortisol levels, and you can actually start to gain weight at different areas around your midsection. Infertility can happen. Coronary artery disease. So cardiovascular disease and sleep disorders are very, very common for long-term stressors. On this particular diagram, it's just a quick little comment here, but improving sleep and circadian rhythm is very important to HPA axis function, and that is crucial. Sleep is crucial for this entire scenario. Supplements to reduce cortisol: holy basil, ashwagandha, rhodiola, and Korean ginseng. That's pretty much standard medical literature, and there's a lot of benefit there. So there's a lot of things that you can look at when it comes to improving it, but sleep, deep restorative sleep, reducing intestinal inflammation, very, very important until you can actually improve the stressor itself or your reaction to the stressor. Now, one of the things we do here in the actual at Synapse here is we'll look at the BIA. Let's see if I can bring this up. And so the BIA is bioimpedance analysis. So let me just go through that here. I'll bring it down here as an example. So with a BIA, you actually are looking at the different markers and where your body is storing water. So again, if you're in a stressed state, your cells literally will fold up. The receptors on the outside of the cell can't actually receive the nutrients, and therefore the water doesn't follow it. So water stays outside the cell. So we start to see an increase in what's called extracellular mass. You'll see that right here, extracellular mass. So we look at the weight of that, and then the phase angle here is given. It's that number 7.3, 7.5, and so we have a little chart that actually is a little cheat sheet. It tells us the relative age of your cells. So if you are losing water inside the cells, that's a sign of aging and dysfunction. So the way of saying it is we start life as a grape and we slowly end life as a raisin. So we can actually measure the water inside the cells to start to see, are we making gains with your stress response? Because when you have a stress response, the HPA axis sends a signal. We start to see a down regulation of the thyroid. The thyroid doesn't activate the outside of the cells as efficiently. Insulin doesn't get the sugar inside the cell, so it becomes bioactively less active. The way we measure it is literally your BIA will start to show your cells shrink a little bit. You start to hold water on the outside of the cells versus the inside of the cells. So it gives us a relative age index too. So we'll see people aging beyond their years. So this is one good way because it's a very, very cost-effective test. Over time and over our programs, like a 6-month program, we'll do a BIA 3-4 times to see if we're measuring some gains here. So you can see here on this particular example, the person started with a 7.3, which if this is a male, that's about cells of a 40-year-old. And then it went to 7.5, which is good. So that's cells of a 44-year-old. Then down to 7.2, down to 7.1, 6.6. 6.6 is cells of a 64-year-old. So something happened here to have them go down. And then when you look here, 4.6, 4.6 is cells of an 86-year-old. So if this happened within a year, this person got hit really hard with something. If this happened over 30 years, not that big a deal. So it's really important to take a look at. But this is a very, very good marker, very cost effective. It costs about $19 to get this. So we will run these BIAs at the clinic with our program patients. Next thing I'm going to show you is one of my favorite tests. It's actually a marching test. And so it's called the Fukuda's marching test. I'll skip ahead here. This is a neurologic test where you just march in place. I like to go a little faster than that, but you get the knees up, eyes are closed. If you march forward, then that's a sign you're in fight or flight. So you can see this person is starting to go forward a little bit, and that's a sign of fight or flight. Your brain is actually starting to send signals to have the body flee. Now, if you start turning from one side, like to your left, you can see he's starting to turn a little bit. We'll have some people actually turn a full 90 degrees in 60 seconds. This is a great neurologic test to actually tell us how you're doing if you're actively in fight or flight. This is one of our physical tests that we'll actually do. Fukuda's marching test. And you can see he's gone forward quite a bit. People with chronic fatigue syndrome, so he went about 7-8 steps forward towards the camera there. So that's a sign of mild fight or flight. People with chronic fatigue syndrome or burnout, we'll actually see them go backwards because they're already past the fight or flight state. People with chronic fatigue syndrome, people with burnout will go backwards, and people with exertion intolerance will start to go forward, and then will actually kind of lose it. You'll see them do pretty good for about 30 seconds, and then all of a sudden go way off to the right, way off to the left, or start to go backwards. So that's why that test gives us a good indication between actual SEID versus the actual burnout, the HPA axis dysfunction. So I love that test just for that marker right there. So that's the BIA again. And then one of the other things that we like to look at is sleep. So sleep disorders can be detected on our physical exam. We check for what's called upper airway resistance syndrome. This is common with stress. So people who have stress, they tend to carry it on the back of their neck. And when we see that, the muscles tighten. And then when they tighten here, it can impact the muscles on the front of the neck. So let me get in the camera here. If I'm contracting this muscle on top here, it's not only contracting here, but it's sending a signal to relax here. So if this is contracting back here, it's relaxing here. Our airway becomes soft and sluggish, weak. And then it collapses at nighttime, and it causes a lack of oxygen. And so that's going to trigger a fight or flight response in the middle of deep sleep. The most common thing that happens during stressful scenarios or after stressful scenarios. We saw this a lot with COVID. People had COVID, and then they came in and they had this instantly within a week. And so, same thing with stressful times in life, things like that. So, chiropractically, we do a lot to reverse that, and it takes anywhere from 2 to 6 weeks. But you can use something like an Aura ring or a Whoop band. We also have an endopat here, which is a technology that measures your heart rate variability as well as the cardiovascular damage that's already been done from the stress. That's one of our other markers. It's called the endopat, one of my favorite tests. One of the other tests that we will run a lot of times is the cortisol awakening response, CAR. We like to use Dutch, and we use Rupa Health and some other companies to order it. But it's a 24-hour, it's a saliva test, and it measures your cortisol and the timing of it. So we can actually see how your adrenal glands are working. So when we combine that physical test with your BIA, with the Fukuda's test, and we look for the sleep disorder in the physical exam, and then we get your normal labs to tell us how your thyroid is doing, how your insulin blood sugar management is doing, and then we get a cortisol test, we've got a good picture of where you're at as far as being able to determine between chronic fatigue syndrome versus burnout. So with this test, you can see here that patients with sleep disorders, it'll pick up a lot of where you're at with the cortisol stuff. It'll give us some actual insight into at what stage your adrenal glands are. So not necessarily the HPA axis, but the hypothalamus, if we've got a blood pressure and we've got other hormones on lab work, we now know we've got a pretty good idea of what the hypothalamus is doing, what the pituitary is doing, and the adrenals are doing. So we'll know what stage you are when it comes to the actual burnout. We'll also do what's called a fitness test to just see at what capacity you have. Are you deconditioned because of adrenal burnout? To finish up here, one of the other things I like to highlight is we will do what's called a DAS questionnaire. So it's part of our standard questionnaires actually, but I want to go through this. So depression, anxiety, and stress scoring is something we measure. We measure at the beginning of every program, and we get a good sense of, from your perspective, where are you with depression, anxiety, and stress scores. As we go through our program, we should see this improve. As we look at the mental, chemical, and physical triggers, we will be able to assess where you're at with the depression, anxiety, stress scores. Now, generally speaking, these scores will affect the burnout, the adrenal burnout, the HP axis dysfunction, more so than the chronic fatigue syndrome or SEID, systemic exertion intolerance. They can be a consequence for sure, but as we are working on things, we'll see an improvement there. And so this gives us a good idea. If someone comes in and they have no stress, no anxiety, no depression, but extreme fatigue, you can almost take it to the bank that that's the chronic fatigue syndrome or the SEID. So the last thing I'm going to just kind of focus on here is mitochondrial dysfunction, because that is, when there's mitochondrial dysfunction that you can measure, that is a chronic fatigue syndrome scenario. That is a systemic exertion intolerance disease. So if you can find any level of mitochondrial dysfunction, boom, you've got it. So there is a test for that. To answer the question that was posed, is there a test? The test is called the organic acid test. There are multiple markers, 4 to 6, depending on which lab you use, that can measure your mitochondrial function. Now, it's not definitive because there's a lot of other areas that can be off. Your thyroid has to be working well. Your blood sugar management has to be working well for your mitochondria to be working. Your mitochondria are the energy and powerhouses of every cell, but they're also helpful in our defense mechanisms. So what's something that happens that can shut that down? Well, Epstein-Barr virus or mono. So mono is an example of an infection that shuts down that mitochondrial scenario. You can see here too that environmental factors, pollution can also do it, mutations can also do it, oxidative stress can do it from poor diet, bad diet. But one of the things that's not on here that is the most common cause is fungus. In fact, in research labs, they use tartaric acid, which is one of the acids released from fungus, to actually damage the mitochondria to then see if they can develop something, medications, to restore and improve the mitochondrial function. So the most common cause that we see, fungus in the intestinal tract from chronic issues like stress. So chronic stress can cause digestive problems like stomach acid not being released properly, the pH changes in the intestinal tract, and then your good bacteria starts to go away and be replaced by fungus. So then what happens when we have stress? We crave salt and sugar. What does fungus consume? Sugar. So the sugar feeds the fungus releases their acids, and the acids damage the mitochondria, and that leads to systemic exertion intolerance disease. So you can see how at a certain point, burnout and chronic fatigue syndrome, SCID, become the exact same thing. So that's why there isn't really a definitive break. You have to be able, unless you're in the first phases of adrenal burnout, you have to be able to put it together, and at a certain point, it becomes the same exact thing that you're treating. So example, for chronic fatigue, we're always going to be working on restoring the sleep, restoring the gut, but looking for the root cause. Is there an infection here, an environmental pollutant? What is damaging the mitochondria? There are certain things like, I'm just going to say this, you have to be very, very careful of certain injections that are being put in that downregulate your intracellular mechanisms. For example, with COVID, they did that, and they gave you things that would actually downregulate the toll-like receptors to allow the delivery system to get in there. Well, what does that do? That decreases your intracellular immune response, making the intracellular components more susceptible to infections. Viruses, parasites, and small infectious organisms like Lyme can then get in there and damage the mitochondria. So we see a lot of the mitochondrial issues. That's the big term and big word here when it comes to the chronic fatigue syndrome, or like we said, the systemic exertion intolerance disease. So I know I went through this very quickly, but there's a lot there to unpack. I actually love this question, and I want people to really get the differences between the two, but at the same time realize the solutions are a lot of times the same. Where you focus in the beginning does matter. So we're going to restore the foundational practices and then just measure, make sure we're making good changes. After that, if we don't see good change, we're missing something. It'll be something like an infection that's still there. One of the other treatments that we do, we developed a technique to help with the triggering mechanisms, physical and emotional triggering mechanisms that shut down the brain's response to regulating your actual muscle and organ function. So we call them the clearings. We will discern through whether or not you need that. That's unique to Synapse. I developed that over 15 years ago in a post-traumatic war veteran. Because of the PTSD, that level of stress and trauma actually induced a mechanism of the muscles just causing a locked-in syndrome, and we have identified that with many of our patients. So we'll go through that, and we have trauma coaching as well that helps people reframe their thought processes, because in today's world, it's not just what we're thinking, it's how we're thinking, and we can induce a lot of the stress response by how we are looking at the world around us. So it really is an all-inclusive mental, chemical, physical, and even spiritual well-being that we have to look at to get this chronic fatigue syndrome and chronic burnout issues addressed. I hope this was helpful. I know there's a lot more to this. We could go through all 55 pages of just the adrenal burnout part of this to get into, to do a deeper dive. But for now, that's what we've got. I look forward to seeing each and every one of you either on the podcast or in the clinic. Take care. Again, this is Dr. Troy, and God bless.
Thank you for listening to the Synapse Snips podcast. If you like what you heard, subscribe to the podcast and share the podcast. To learn more, check out our website at www.officialsynapse.com. Until next time, this has been Synapse Snips podcast. We'll see you on the next episode. This podcast is for information purposes only and should under no circumstances be considered medical advice or substitute for medical care. Any information given in this podcast is not intended to diagnose or treat any disease and is at the user's own risk. Please first consult a licensed healthcare professional.